Well, good morning, everybody. Welcome to Ohio Suicide Prevention Foundation's Voices for Suicide Prevention Advocacy Update. I'm OSPF Communications Director Stephanie Bucher. We are going to allow for some time after the presentation to answer some questions, so please use the Q&A feature. That's the Q&A feature. And so we'll get to those after we hear from Tony Coder, the CEO of the OSPF. Tony?
Excellent. Thanks, Stephanie. Very excited to have everybody here for our initial one. We will be doing these monthly. These will focus pretty strictly on suicide prevention. If you want AOD advocacy webinar, Prevention Action Alliance does a great job of doing an advocacy webinar monthly as well on AOD issues. So we will stick strictly to probably mental health and suicide prevention. Now, I'll talk a little bit later about, we will focus on some bills later that might not seem like, well, what's that got to do with suicide? I.e. Medicaid, some of the issues there that if people can't get Medicaid, they can't get insurance, then obviously our rates of suicide might climb because folks will not be able to get the care that they need. So this will hopefully cover a lot of things and be helpful to you each month. We will record these so that you will have access to these later if you'd like to review them or you can't make it at the time that we have these. But again, welcome, and I'm really excited about this. Today's going to be a little bit different. What I would like to do is kind of level set us on what advocacy versus lobbying is, and go through that because I used to get that question an awful lot, and I want to make sure that, especially as some of us are nonprofits, some are boards, some are groups that might not have lobbied in the past, that we stay within the 501c3 guidelines. If there are really specific questions, you might want to seek an attorney's guidance, but taking some of this advice and some of the things that from the IRS website. We don't want anybody's 501c3 to be in jeopardy or anything like that. So, Stephanie, if we want to start with the slideshow. All right, and that's my ugly mug. So if we want to move to the first slide there, what I thought we would do is to focus on these webinars on a variety of different things. We will very rarely talk about anything international, any international policies, but we are part of the International Association for Suicide Prevention, the IASP. So, there could be some issues from time to time, but we will not focus on those an awful lot. So, though that's something that will probably not be brought up every webinar. Heck, it may not even be brought up every, sixth webinar. But that is something that if there is there is an issue that is international, we will talk about it, but that will not be a focus. We will talk some on federal issues. Federal issues are a little harder to grasp. We do have someone at the federal level who helps us with policy issues with Congress, and they have provided an update that I've taken some pieces and we'll tie them into here. We'll focus mostly on what's happening at the state level. Not only state legislature, but also we could talk about rules. We could talk about things going on at the departments and with the administration. And then also, I will not be doing these every time. Austin and Daniel will be doing these as well. And I would love for folks to weigh in on what are people doing locally on the advocacy front, and maybe highlight some of those. Maybe invite you on as a guest to some of these webinars, because local advocacy is really, really powerful, and it's a lot easier to get done than it is, especially at the federal or even international level. So those are the four kind of the triangle that we're going to focus on in these, and hopefully, again, we'll be able to get some information out of it that will be helpful to your mission. So next one. So is advocacy important? I've always thought advocacy was important. I know that I hear the saying an awful lot in suicide prevention that, oh, if I just save one life, and absolutely, if we can save one life, then our work is definitely worth it. But if we could instead also impact entire communities and have that community change, having stigma broken down, people talking about it more, people being able to address their needs. That's a really, really powerful issue. It's also something that can have lasting reform. So not only, this is generational work that we're doing, that the foundations that we're laying here will be for generations to come. It's also an opportunity to educate the masses. So I know that traditionally, suicide has been one of those words, suicide prevention, where, there are still pockets in the state. Well, if we don't talk about it, that somehow it will go away. Well, that's not really the best way of working with a health problem. We don't work with health problems like diabetes or heart issues. Oh, if we don't talk about diabetes, then it'll just go away. Well, that's not necessarily the case. That actually is counterintuitive. When we do talk about it, we can educate others, we can share, and we can actually get better outcomes. And then also, advocacy is an environmental prevention strategy. There's environment. We can change an entire environment just by doing a policy change, as opposed to trying to do, that direct service. Again, that's extremely important. And we want folks to get, good prevention strategies, but we also, we want get people to get good treatment. We also want folks to be able to access good post-vention strategies and support groups, those really direct service types of opportunities. But we also want to make sure that if we can save more folks with policy change, that we can also make those changes as well. So that's what we hope to be able to provide some of this information. That's why I think advocacy is so important and that our voice is needed. So next slide, please. Oops, the one back. Yeah. So when I worked for Governor Bob Taft, one of the things that he told me that I have always kept as I guess as a guide in my mind was he said, anytime you're dealing with a legislator, you're dealing with someone who knows an issue a mile wide and an inch deep. So basically, what that means is that legislators, especially, have a vast amount of information they have to acquire to make the best decisions for the state of Ohio. And so, really, they have a little bit of information and a little bit of knowledge on each subject, but it's only about an inch deep. That's why you are so important in the advocacy of our legislators. That you are the local expert. Again, they've got a little bit of knowledge on suicide prevention. They got a little bit of knowledge on mental health, but you're the local expert. You know what you know. You're doing this daily. You're doing this day in and day out. You're not only seeing the stats and the numbers, but you're talking to people and you're understanding the anecdotes that's happening in your local community. So that's something that legislators need to hear. So you are the local expert. You're also not a lobbyist. They see lobbyists all the time. Legislators do, and lobbyists serve a good function. They do an awful lot around making sure that the bills move through committees and that they're up to date and they're actually at the state house. But also hearing what actually is going on in their local community is really, really important. And as I said earlier, if you don't speak up, someone else will. Who's telling your story? Who's talking about suicide prevention to legislators that might not be, quite frankly, in line? We I think, have more pure motives that we're trying to save everyone's life. We're trying not to, we don't really try to, we're not profiting off of this. We're not trying to sell a product. We're instead trying to sell basically life-saving strategies, and doing that, telling our story is really, really important for our legislators to hear. And also, advocacy is it's a marathon. It's not a sprint. So much of what happens depends on political or leadership views. So even though you'll get knocked down, 9 out of 10 times, that 10th time it'll make it worth it. But it's a long slog, and there's a lot of things that you have to consider. I always say in our advocacy, not only who are our friends, who are our partners, but who would be against this as well. So we have to understand and know what their arguments might be so that we can then counter those arguments and actually make the argument that we want to make before they do. So don't think that, oh, this didn't happen, or this advocacy, has failed. No, sometimes it just takes a long, long time. So, I encourage patience is key in advocacy work. So next slide, please. And advocates, I think we get, when we talk about advocacy, I think we kind of get into a system where it's like, oh my God, advocacy, it's lobbying, you're going to meet with state house officials. Really, it's what you do every day. Advocacy is just a fancy word to say educate. You're building relationships with others. You're trying to help not only educate, but also build that relationship so that you can be that expert that I talked about earlier in their community, that you can lead the cause on behalf of others and are persuasive. I know that when a member of my family was struggling, I didn't have time to pay attention to what policies were going on. I was so focused on what I needed to do for my loved one to get the help and the care that they need. So you're really leading the cause, and you're being that voice on behalf of others, and you're also persuasive. Again, you have those local stories, those local numbers that are so important for legislators when they're making decisions. So, let us all, we're doing that already. And let us not forget that we are really being the voice for those who are voiceless and those who are struggling. Again, educating legislators. You're doing that with every other sector of the community. You're educating schools, you're educating workplaces, you're educating providers and hospitals and everyone else. So this is just basically getting dressed up, gussied up, and educating legislators. It's nothing to be scared. You're doing this all the time, but you're also identifying problems that need to be addressed. You're contacting decision makers, and you're encouraging them to address the issue. That's what they're elected to do. That's their job. And I in my conversations with legislators, 99% of legislators absolutely want to do what their constituents want. They want to address the issue. They didn't come into this into the field of legislating and being a policymaker because they had some grand ideas. There are some, but the vast majority really do want to help their community and address the issue. So, that's something that I think we have to make sure is to that these are human beings, and they're there for pretty pure purposes, and that we need to help them in their jobs. So, next slide. So, very quickly, a little bit about advocacy versus lobbying. Advocacy is education about the issues, sharing information. Advocacy is also, if a legislator calls you and says, "Hey, I need your response. What do you think about House Bill 33?" And it's about whatever issue, AI. You can absolutely, as a 501(c)(3), respond to that, and give your opinion on that issue. That isn't lobbying. Lobbying is when you are calling the legislator and saying, "I need you to vote this way on a specific piece of legislation." That's where uh, nonprofits can lobby, and we'll talk about that in just a second. But that's where that lobbying line, again, education versus telling someone how to vote on a bill. So even if a legislator says, "Hey, I'm thinking of crafting a bill," since it's not a piece of legislation yet, you can help that legislator absolutely craft a bill or craft some language around whatever issue, and then you can then that would still be lobby, or I'm sorry, that would still be advocacy. So, I want to make sure. And if you ever have any questions, again, you can call us, but, also, if you have an attorney or someone like that, they're pretty good at make keeping you out of trouble. But it's kind of and there can be some gray areas, but it's pretty easy to that if you're educating and that's all you're doing, then and you're not like, oh, you need to vote this way on a certain issue, then you really don't have a whole lot to worry about. So next slide. All right. So lobby. What can nonprofits do? Any person can lobby, and actually coalitions and nonprofits can lobby. I think it's up to 15% of your um, non-government funded funds that you can actually lobby. But again, you can't use government or public funds can be used for lobbying. Funds have to be unrestricted or through some kind of private donations. You cannot use any government funds um, to lobby at all. And you can also not use funds. So if you're collecting funds through an unrestricted campaign or through a donor campaign that are going to be utilized as matching funds for a federal grant, you cannot use those funds as well. So, if you're having some extra dollars that are have been given to you through whatever means, whether it's through an event or whether it's through a private donation, you can absolutely use those funds to lobby. Again, I would the 15% of a person's of an organization's time can be used that. Now, mental health boards are different; they cannot lobby. So, if you work for a mental health board, I would really stick really close to the advocacy piece. Agency rules. I actually checked on this yesterday. And 501, the IRS says efforts to change agency rules, regulations, or policies are generally not considered lobbying. So if there's a rule that's happening in DBH or ODH or Medicaid or wherever, you can absolutely make a comment, a public comment on those rules and not be violating any lobbying restrictions. And again, most of the time we'll be talking about advocacy, and again, advocacy is just a fancy way of saying educate people. So next slide. So this is what we'll be looking at. Again, I wanted to give that kind of level set, what we'll be as we move forward. But this is what we'll be doing on these webinars that are happening monthly. We're looking at federal legislation. In fact, we're going to DC next week to talk a lot about some of these pieces of legislation, and especially around technology. A number of bills have been introduced in Congress to address youth and veteran suicides, but they really aren't showing any movement right now. The Youth Suicide Prevention Research Act, law enforcement and mental health wellness programs. In fact, I think they sent me a list, and there's 18 bills that are actually dealing with technology and suicide prevention at the federal level, and most of them are just an introduction or in the committee stage. The AI technology bills are also at a standstill. However, they were written up, which basically is a fancy way of saying that they were edited and some changes were made, some amendments were made and hopefully those will start moving forward. So some of those AI and technology bills could be moving. The Kids Online Safety Act and the Chat Act, both are supported by Ohio Senator John Husted. I know the Chat Act is something that Senator Husted actually introduced, and the Kids Online Safety Act he's a co-sponsor of. But again, going back to that pyramid, and we'll be following up with all of these bills if they do move forward. Also, again, going back to this is a marathon and not a sprint. Only 11% of all federal bills last Congress made it past committee, and only 2% were actually enacted. So you're talking about thousands of pieces of legislation, and you're talking less than 100 that actually made it into law. So it is, a lot of these bills have been introduced in past Congresses. So, this is something that We really, again, I don't want you to lose faith. I don't want you to lose hope. I always, the baby steps are what's really exciting to me, that if something does move, and it seems like, almost a layer of the earth where it's a little bit of a movement before you have the big earthquake, or, let's focus on those little bits of movement that we can get. And again, advocacy and advocating for the best policies for the folks that we serve. Next slide. And then state legislation. Um, Talking about, again, we'll be doing the majority of these webinars will be about state legislation. There are some technology bills that we've been focused on, Senate Bill 167 and the companion bill, House Bill 226, by Senator Reynolds and also Representative Miller. It's an age verification for app stores. So that is a bill that would require age verification for any kid under the age of 16 to get verification of their age from a parent, and that would have to go through the App Store. It's in committee right now. I know Senate Bill 167 has been in a couple of hearings. I know myself and Prevention Action Alliance have provided testimony on those. And then House Bill 524, penalties for AI models suggesting harming oneself or another person. That has had a hearing as well as House Bill 525, and those are also in committee right now. One of the things with state legislation as well is sometimes things get held up because there are larger priorities of the day. A lot of times, especially at the state level right now, a lot of the conversations around Medicaid, around property taxes, and those types of things. So, getting, advocating for these things is really important so that they don't get lost and forgotten about. The other bill that I wanted to focus on and make sure that you knew about was the Keep Them Safe Act. And this is a bill that we have worked with gun shops around the state. Lifeside Ohio has, and basically it would allow gun shops and firearm retailers to become safe storage facilities for folks in Ohio, so that if someone is feeling unsafe or they have kids around or something, that they could legally store their firearms at a firearm retailer. Again, it would be voluntary, so it wouldn't be like every retailer has to do this. But it is something that the firearm retailers want, and it's a good practice of having that extra time. We talk a lot about lock boxes and safes and all that. This would be another opportunity to make sure that guns and firearms are kept away from someone who might be struggling or from kids who might be struggling. So Senator Kaler has introduced that, and I know that has gone through committee, and I think it's actually voted out of the Senate and is actually in the House. So any House members that you have that might that could support this. Again, this is a gun. The gun shops are in favor of this, so we're not trying to restrict anything. This would be something that would be, I think, we could all get behind. Also, on state legislation, we're talking a lot about AI and all that. President Trump did sign an executive order to challenge state laws regulating AI that it views as overly cumbersome or unlawful, calling for the development of a minimally burdensome national standard. Now, New York just yesterday actually created an AI control office. So I don't, executive orders are, basically an order that orders uh, the agencies to do something. It doesn't actually make it a law or anything. So, we have to think about the executive order and how that impacts state work. But it also, New York seems to just kind of be moving forward. The other thing is right now is kratom. The governor issued an executive order, and the Board of Pharmacy has actually submitted rules to classify kratom as a Schedule One substance. It's a substance that some folks struggle with. And I found a little bit of research on from Johns Hopkins that persons who use kratom exhibited higher odds of reporting past year suicidal thoughts, plans, and attempts compared to persons who have never used kratom. So there is some research around suicide ideation, suicidal thoughts, and the use of kratom. And I know that we will be supplying some public comment, which are due January 28th, to the Center for it's CSI. I can't remember what the acronym is right now. But if you would like more information on that and to supply those a public comment, we would love to be able to help you out with that. So we got about 5 minutes left. Again, I rushed through this, and it was probably a little bit more education around lobbying and advocacy than you were probably expecting, but I wanted to level set and would love any questions that you have.
Yeah, we actually do have a question. Someone was asking Tony if you have any specific actions for good beginning steps to connect with legislators.
Yeah, I think this is an election year. This is a perfect year to really start those conversations with legislators. Legislators are looking to get out and about with people, especially our House members. So being able to invite them to a coalition meeting, come out and see your facilities, come out and see, if you work within the schools, have them tour, go on a tour with you of a school or a 988 center. Again, it's amazing how the amount of information they have to know and the little amount that they know deep down. So any type of that type or that kind of engagement where like, oh, literally they're getting a bit of an education. And again, it's an election year, so they're wanting to be out and about. That would be really, really valuable. So I would invite them to a coalition meeting or another event that you're having.
It's always good to establish those relationships in good times, positivity, as
Mhm.
opposed to we need you to totally not do that legislation. So something that could be, deemed as kind of negative, I guess, would be one way to look at it.
Yeah,
Yeah.
that's a good point that you always want to be their partner. And yes, there are disagreements. There's lots of disagreements I've had. Again, I get along with 95% of the legislators, but there are disagreements, even folks who I consider really good friends. That doesn't mean I make them enemies. So, they're there to work for us and not being, really confrontational or, never ever say, you know what, I'll work to not get you elected. That's the silliest thing you could ever do. Again, they want to be partners. The majority of them want to know what's going on in a community. So being that partner and being able to have those folks at your coalition meeting and in your corner is really helpful. Not only now, but as we look toward the budget and especially to a new administration coming up, whether that's Ramaswamy or Acton. Those are good partners to have as a new administration takes hold starting next January.
Yeah. I don't see any other
All right.
questions. We'll go ahead, and I just want to do a couple of shameless plugs if you all don't mind. Thanks again, Tony. We really appreciate that insight. We have a couple of things that are coming up that if you would like to mark your calendars for. March 4th, we're co-sponsoring a webinar to discuss the intersection of AI and suicide prevention. And we'll have some national experts and policymakers joining us in that conversation, and we'll send out details about registration very soon. September 1st through the 2nd is our Together Forward Action, Engagement, and Advocacy in Suicide Prevention, a 2-day virtual conference for real voices, real work, and real connection. So look for conference details as they become available on your website. In fact, you can scan that QR code and go right to that page right now. We'll have some more information very soon for that September 1st through 2nd event. And also be sure to register for our next Voices for Suicide Prevention Advocacy update, February 10th. You all said that you love the idea of a monthly webinar, and so we will certainly continue to do that, and you like the morning. So please look for your inbox information related to our next update. Thanks so much again, Tony, and everyone else who participated today in our inaugural webinar. Take care and have a great day.
Thanks, everybody.